In this video, we are going to see about the large intestine meridian. Before that, I welcome you all to the Akku world. The large intestine meridian comes under the metal element. In TCM, it combines with the lung meridian. The large intestine meridian has 20 points. It is the young organ of metal element. Its organ clock timing is from 5 am to 7 am. The large intestine channel starts from the tip of the index finger running upward along the radial aspect of the index finger. It passes through the index space of first and second metatarsal bone and along the lateral anterior aspect of the upper arm to the higher aspect of the shoulder. It then travels along the anterior border of the acromion, then descends to the supraclavicular fossa. From the supraclavicular fossa, it travels upward to the neck and then to the cheek. Let's move to the points now. LI1. It is the Jingwell point of LI Meridian. It is the metal point of LI channel. It is also called as the own point or horary point, which means the same point of same channel. It helps to regain consciousness. It reduces toothache, throat pain. It also treats numbness of fingers. It is a very good point to treat malaria. LI2. It is the water point of LI meridian. It is located on the radial side of the index finger, distal to the second metacarpal phalangeal joint, a depression at the function of red and white skin. It is used to treat bone pain, finger pain, nose bleeding, toothache, throat pain, cloudy vision. It also clears heat from the body. It is also called as the sedation point and distal point for mouth. LI3. It is the wood point of LI meridian. It is located on the radial side of the index finger, proximal to the head of the second metacarpal bone. It helps you to get rid of finger pain, hand pain, bone pain, swelling, and redness of the finger. It also treats eye disorders and it also clears heat from the body. It helps you to elevate pain. LI4. It is the heavenly star point. It is also analgesic point and a distal point to cure the whole body pain. It is located on the dorsum of hand between the first and second metacarpal bone. It has so many benefits. It reduces hypertension, headache, joint pain, chill fever, continuous sweating and absence of sweat. It also treats swelling and pain of eye, dimness of vision, nose bleeding, nostril congestion and discharge, sneezing, mumps, toothache, mouth ulcer, cracked tongue, and loss of voice. LI5. It is the fire point of LI meridian. It is located on the radial side of the wrist between the extensor pollicis longus and brevis tendons in a depression formed when the thumb is pointed upwards. It is an important local point for disorder of the wrist. It clears heat from the body, it cures malaria, and it reduces wrist pain. LI6. It is the Lu connecting point. It is located 3 chun above the transverse crease of the wrist on the radial side of the forearm. It reduces hand pain and paralysis. It cures redness of eye, malaria, tinnitus. It also clears heat. It also treats deafness, toothache, tooth decay, cold teeth, rhinitis, and nose bleeding. LI7. It is the C cleft point. It is located 5 cun above the transverse crease of the wrist on the radial side of the forearm. It treats acute disorders. It reduces headache, stomach pain, shoulder pain. It also cures swelling of face, hand paralysis. It accumulates stomach and large intestine. LI8, LI9 and LI10 will be measured from LI11. LI8 is 4 cun below LI11. It reduces stomach pain, elbow pain and hand pain. It harmonizes small intestine. LI9. LI9 is 3 cun below LI11. It treats numbness of hand. It also reduces stomach pain. It treats dark urine, headache, and it harmonizes the LI. LI10. LI10 is the motor recovery point. It is located 2 cun below LI11. It treats polio paralysis, diarrhea, headache. It cures all type of arm and shoulder issues. It helps in the mobility of hand and it also treats lumbar pain. LI11. It is the earth point of LI channel. It is also the immune enhancing point, tonification point and heavenly star point. It lies on the depression at the lateral end of the transverse cubital crease, midway between LU5 and lateral side when the elbow is bent. It treats chronic diseases. It also treats hand paralysis, knee pain, skin disorder, itching, elbow pain, redness and swelling of ankle. It also helps you when you have poor memory. It is the important point to reduce heat from the body. It is called the ghost point. LI12. We can locate it easily when we flex our elbow. It is 1 cun lateral to LI11. It cures hand numbness, frozen shoulder, elbow pain and tennis elbow pain. LI13. It is located 3 cun above LI11. It helps you to get rid of shoulder pain, tendons pain, especially it cures the pain in the upper tendons. LI14. It is located 4 cun above LI13 at the inferior border of the deltoid. It reduces hand pain, shoulder pain, redness of eye. It also helps you to get rid of frozen stiff neck. LI15. It is located anterior and inferior to the acromia on the upper portion of the deltoid muscle in a depression formed when the arm is in full abduction. It cures paralysis, especially hand paralysis. It alleviates pain. It also helps you to get rid of frozen shoulder. It reduces the heat sensation of shoulders and it also cures pain in the shoulder joint. LI16. It is located slightly posterior to the shoulder in the depression between the acromion process and the scapular spine. It helps you to get rid of frozen shoulder, goiter. It also supports the shoulder joints. LI17. It is located on the lateral side of the neck, 1 cun below the LI18. It is the Varma point. It is the endocrine point. It is very useful for thyroid, throat problems, loss of voice, goiter, mumps. It also benefits the throat and larynx. LI18. It is located on the lateral side of the neck, trichun, lateral to the Adam's apple. It cures thyroid, asthma, tonsils, endocrine disorders, swelling and pain of throat, rattling sound in the throat. It also helps you when you have difficulty in swallowing. It also cures cough, wheezing, hypertension. It also helps you to regain your lost voice. It benefits your throat and larynx. LI-19. It is located directly below the lateral margin of the nostril, 0.5 shun lateral to the DU26. It cures all kind of nose disorders such as nose bleeding, blockage in the nose, sinus, running nose, and it also helps you to get rid of toothache. LI-20. It is located in the nasolabial sulcus level with the midpoint of the lateral bordle of Alanasi. It is the important local point for all kind of nose disorders. It opens the blocked nasal passage. It cures the bleeding nose, running nose, and pain in the upper jaw. It also cures facial paralysis.